So in this video, I will talk about magnetic stimulation in cognitive neuroscience, and it refers to the use of magnetic fields to influence and study some brain function. And one of the most famous and widely used technique, it also approved by the US Food and Drug Administration in 2028 for treatment of major depressive disorders. It is known as the transcranial magnetic stimulation, or TMS, as you can see its name here. And it has become a very valuable tool in neuroscience research. So TMS involves the application of a brief and intense magnetic field to the scalp, like the outside area of our head, then which will induce many electric currents in the underlying neural tissues in our brain. Then these induced currents will modulate the neuronal activity and the brain function, and it will temporarily disrupt or enhance brain function in a controlled manner and with some specific target, and it depends on the specific and different disorders that need to be treated. So for example, you see here a diagram of different area in our brain, So for example, the depression patient, usually they will have some low active region in the front part of their brain, which calls the prefrontal cortex. So this method will be applied to those patients, and it will have to reactivate those brain region, and it has been proved to have solved their problem. So how does it work? So the first theory that we need to consider is the Ampere-Maxwell equation. So it describes the application of electric current. Like when an electric current flows through a surface, or there's a changing electric flux to that surface, it will create a magnetic field around that area. On the right hand side, we can see the electric current enclosed and the changing electric flux formula through the surface. So this will be controlled using a DC or AC electric current flow through the device that put near our head to create a magnetic field. Then this changing magnetic field will then induce an electric field according to Faraday's law, or the third Maxwell equation. And the reason for this is that our neuron in the brain is actually electrically conductive. So that is why this TMS is called non-invasive method, because it does not require surgery, or the doctor have to use the tools to directly influence and perform the treatment with our brain during the surgery. But instead, it all works by induction from electric field to magnetic field and back to electric field and induce current in our brain tissue. And it can all explain by electromagnetism. Now we'll talk more about its real application. So to apply on each patient, of course, the doctors need to determine the stimulation level need to give to each person and to give to each disorders. And there's something called a motor threshold. And the doctor will first identify the area of the brain that controls the movement of our hand. Then the doctor will apply the TMS device to that area of our brain. Then he or she will send a higher and higher pulse of electricity to create the electric and magnetic effect, and until the doctor see that our hand muscles start to contracting, and that will be how the doctor determine the limit or the level of stimulation that he needs to give to the patient. So, and also the doctor will ask patient if they have change in sleep or any new medication that they're taking, or did they use any alcohol before the test. And from that, combined with the motor threshold, the doctor will assess the cortical excitability and will determine the final stimulation level to give for the person. And here's some of the future trend improvement of TMS, including identifying more treatment targets of the brain neuron system to shorten the time of treatment for each person. And also the method will be improved to apply for more severe psychiatric disorder, including schizophrenia or tâm thần phân liệt in Vietnamese, and that is TMS.